Thanks everyone for coming. This is a larger turnout than I frankly expected for a Sunday afternoon lecture, so I'm excited to see everybody here to talk about foster care. And unfortunately, I wasn't able to make it to Dr. Henry's lecture just before lunch, but I wonder if this probably complements her lecture on neonatal care, hopefully relatively well, because our goal is to kind of step beyond neonates and talk about creative uses of fostering and strategic uses of foster care. I want to add the caveat right from the start that this is approaching this subject from sort of a brick and mortar shelter perspective. I think a lot of the same ideas apply if you are a foster-based rescue. I will definitely slip into talking about this from a perspective of a brick and mortar shelter that's using foster care as a supplemental resource. But again, I hope there's, for those of you that might be at foster-based rescues where foster is your shelter, hopefully many of this will be applicable. So what we're going to cover today. So all that to say, I'm going to go through a little bit of the basics. I mean, this is not intended to be a kind of exhaustive talk about foster care in shelters. Certainly that's been covered. I think for a lot of us, we're using foster care in some manner, and I'll kind of poll the audience in a minute to find out exactly how. But we'll go into a little bit. Review what are the benefits of foster care, some basics of how to keep a foster system running smoothly, because that stuff's really important if you are going to expand how you're using foster care to your organization, knowing that you've got your basics down for how you're running your program. And then we'll get into the meat of it, which is let's talk about some ways that shelters are using foster care in kind of neat and creative and fun ways. So, speaking of all of you, I was curious to kind of get a feel for the audience and what you're already doing with foster care. So, show of hands, how many of you at the organizations that you work or volunteer for are using foster care for underage kittens and puppies? Good. That was the assumption that I was making, that everybody in the room. I think that's the core of what we're using foster for, and that's obviously incredibly appropriate and incredibly important, as I'm sure Dr. Henry talked about before lunch. How many of you are using foster care for medical recovery? So say animals that are recovering from surgery. Awesome. That fits too with what I was expecting. I feel like that's kind of the next thing that many of us go to, but we'll delve into that because I think that's new for some organizations. What about for behavior rehabilitation? Cool. How many of you are using foster care as just like a break from the shelter for otherwise normal? Great. And then how many are using foster for temporary sheltering? So for an owner that has some sort of circumstance where they temporarily can't care for an animal. Cool. Yeah, and we'll go through a little some of these as examples for those that aren't doing some of these programs. We'll talk examples, and I would love for those of you that kind of went down that full list, raising your hands, to also share some of your kind of lessons learned and successes with some of those programs. How many are using foster care for some totally other reason that I did not mention? All right, you guys, I would definitely love you to chime in at the end and talk about how you're using your foster care network, because I would love to learn more. All right, but before we do that, let's talk basics. So the benefits of foster care, I think I am, based on the show of hands, I am preaching to the choir with this, but foster care obviously has tremendous benefits in the shelter. I mean, I am a shelter veterinarian, so of course, you know, when we're talking foster care, one of the main benefits is reducing disease exposure, which goes very hand in hand with the reducing stress aspect because of the way we see that interplay between stress and disease in our shelter population. So if we get animals into a home environment or another environment, as a teaser for later on, we're getting the animals into an environment that they feel more comfortable in, that they are exposed to less disease. I mean, putting our animals in shelters is just like putting kids in school and everybody gets sick from one another. So if we're keeping them in an environment where they are less exposed to other animals, clearly that's going to reduce their risk of getting sick. And we talk about that a lot when we talk about our neonates, and I think that's where the concern really comes to a head. But that's important even when we start to talk about other populations as well, particularly when we start to talk about the flip end, the geriatric cats, or animals, the other animals that might be more prone to disease. Another benefit of foster care is that in a foster home environment, you get more individualized care. I mean, no matter our best efforts in a shelter, ultimately we are tasked with caring for a large number of animals in our shelters. And we can do the best we can at that, and there's great strategies to be really effective at that, but it's different than what you can do when you have one litter or one animal that you are tasked with caring in addition to, your normal home to take care of. And so it leads to more individualized care, which has all sorts of benefits, not the least of which is that you have the ability to observe an animal in a home environment. So you've got that person observing this animal, and so if we're talking about a traditional foster home in a home environment, that is where most of our animals are going to end up, is in somebody's home. And so watching them in a shelter, and I think oftentimes we're particularly talking about behavior, but this certainly comes up with some medical concerns. If we have a cat with cerebellar hypoplasia, that it's hard to tell if it can really use the litter box in the shelter because the litter box is right there and it's right there. But in a home, we can get a better feel for that. And then certainly when we're talking about behavior, watching an animal in a home helps us to tell an adopter what that animal will do in a home. And so there's a lot of benefits to that ability to get those observations from our foster caregivers. And then another benefit, of course, is that if we have an animal in foster, it's not in our shelter. That's a tricky benefit, because you have to remember they're still in our system, and so they're not just sort of sight unseen and gone. But that said, it can help to alleviate, kind of be a pressure valve release for some of our shelters, especially when we get to this time of year and we're mid-kitten season. Any question about the benefits of foster care? Again, I'm kind of blowing through some of the basic information pretty quickly so that we can get into sort of more innovative uses of it. But before I move on, any questions about the benefits of foster care? Cool. So let's talk a little bit about what makes for a successful foster program from sort of an operational standpoint. Because it's important to come to a foster program with planning and organization to make it run smoothly. And so one key aspect of running a foster program smoothly is planning ahead. And that's very difficult to do, to pull up and plan ahead. When we talk about our neonates, especially when we're talking about kittens, there's a seasonality to it. And so it means kind of planning at the end of kitten season for the next season. But it also means if we're going to talk about bringing in a new aspect to our program, planning for that. And the first step in planning is deciding on your target population. So keep saying, neonates is a very common target population. That's what most of us are already talking about. But if we're deciding to add on to our program, what is that target population of animals that we want to head to next? Because if we plan that ahead, then we can move on to the next bullet points and start to look at some of the data, basically, in our capacity to help plan whether that target population is something that we can do. So analyzing your data, all shelter veterinarians are a little bit of data nerds. So I will always preach about the benefit of data, but it's important to look at your numbers, to have some idea. So if you're planning for your next kitten season, how many kittens came in last year? How many came in the year before? Get some idea of what you can expect. It's not perfect, but it gives you some idea. Same kind of idea if you decide, we're going to start to plan to expand our foster program to accommodate people that have to, that maybe there's a landlord issue or there's a temporary issue, housing issue. Let's look at our intake data for last year. Let's get some ballpark of what number we're dealing with. And that can go so on and so forth. Whatever your target population is, get some idea of your data to have some ballpark of what you can expect so that then you can assess your capacity. And when we talk about capacity in a foster care program, the obvious capacity factor is foster homes. Obviously, we need to make sure that we're not planning beyond what we have for foster homes, or if we are, that's a component of our planning, is that we're going to increase and recruit additional foster homes. If we want to start fostering dogs for behavior modification or rehabilitation, we need to go out and recruit that if we don't have that subset of foster caregivers in our network. But it's not just them. When we talk about capacity, we have to remember all the things back at the home front that are keeping this program running. So all of these animals, there needs to be somebody that's managing this foster network. There needs to be that coordinator, that's helping to keep everything running smoothly. There needs to be those systems in place. All those animals are going to come back, need to get adopted. We need to make sure that we have the adopters for the animals that we're putting into foster care, that we have the capacity for the spay-neuter to keep up with it. If we decide we're currently not doing bottle babies, but we're going to add bottle babies into our program. Well, okay, can we accommodate that increased number on the back end of things when they come back in? And then the last part of planning is creating your game plan. Nothing in sheltering works as your game plan is planned, but at least have an idea, have a system for how it's going to be approached, get your system going. And so then keeping it running smoothly kind of works off of these same basic tenets. Again, I like data, I like an organized system, and an organized database is a huge component of any foster program, no matter what you're doing. It's a huge component of any shelter, but especially when you're talking about foster programs, I think there are still some really great shelters out there where the foster network is mostly in somebody's head. And so making sure that you have a database, that everything is organized, it's accessible to all the people that need to have that information, and so you've got a system in place. You also need to, as part of a successful foster program, you need to communicate regularly with your foster caregivers. That organization that's happened for you guys and for your staff and for getting everything going, that needs to extend then to the way that you're commuting with your foster caregivers. Make sure that they know the plan, that they're kept in touch with, that they know who to get back in touch with if they have any issues or any concerns. Provide clear directions to your foster caregivers. And some of that gets particularly important as we start to talk about ways to use foster creatively. Because if you're going to expand into some of these different avenues for foster care, some of which come with some pretty significant complexities along with them, be sure to provide, if you have a good infrastructure for communication and providing directions to your foster caregivers, that's going to help support that program for success. We have whole lectures on kind of foster on deck and getting animals out into foster care quickly, and there's all sorts of stuff we could talk about that, but just to mention, it's important as part of your capacity planning and as part of a good foster network to get animals out to foster care quickly. You don't want animals stagnating in your shelter waiting to go into a foster program. And that even applies, that's particularly important when we talk about our pediatrics and our neonates that are most susceptible to disease, and we need to get them out of the door quickly. We can predict them a little bit better, but even when we start to talk about other populations, being sure that they're not stagnating and just waiting for a plan applies just as much to foster care as it does to every aspect of running your shelter. Monitor your capacity. So you've done all this planning. We have the capacity to handle this. We have the foster homes. We have the team that's working on it. But if you're finding that you've got animals stagnating, you can't get them back in for spay-neuter because that's all logged up and they're starting to back up in foster care, reassess your plan, keep an eye on things, be aware of where you might have bottlenecks in your system. And then last but not least, and we'll talk about this a little bit as we go through some examples of creative fostering, stay on mission with your foster network, especially if you start to expand into other populations, other programs. It can be easy to snowball and then start to have it hard to say no. And so if you are, if you make a directive for what your target population is going to be, make sure it is within the mission of what you're doing as an organization, but also that you stay on that track and that you don't kind of start to continue to creep upwards and upwards. If you decide that your mission as an organization is to reach out into your community and help your community, and you decide, okay, our next step is going to be we are going to temporarily shelter animals from domestic violence situations, but then you have somebody that comes that had a fire in their house, it can be easy to have it snowball into something that gets out of control. So just be sure to stay on the mission of what your program is and then plan ahead for what you can do next when you're at a point where you have that capacity to do so. And so that is pretty much all of my background about fostering slides. Again, I think I'm preaching to the choir with all of that information because you guys are already doing all of this. But moving along, let's talk a little bit about creative fostering, and then we can keep kind of discussion and comments and questions going as we go through it. Let me tell you a little bit about so when I was tasked with this topic, looking at it from a creative standpoint, I have a little bit of background from when I was in clinical practice at the ARL and some things that we were trying, something that some of our ASPCA partner shelters or internal programs are trying, but I definitely didn't feel like I had a comprehensive knowledge of the way that all shelters were doing all sorts of cool fostering things. So I put a question out to the Association of Shelter Veterinarians Facebook group, just out to the group, how are you guys doing foster care in a way that you weren't before? What are some new and innovative things that you're doing at your shelters? And then I got back, so it was just a very informal kind of pull out to the group. And I got back the whole list of all the things that people were doing at their different shelters. And looking at that list, I identified sort of 4 themes to ways that groups are using foster care in new and interesting ways. So this is how I grouped them. And so I think one big way was targeting new populations, and we're talking about animal populations with this. So looking at fostering animals that we weren't thinking about foster for before. Another way is expanding your services. So I keep mentioning, I think a lot of us are expanding into community outreach as organizations. I think it's a big trend. It's a wonderful trend. As we talk about expanding our services, can foster apply to that? And that's something that I definitely noticed as a trend with some of the answers that I got and some of the things I've seen firsthand. Rethinking the foster duration was one that we'll delve into, rather than just that, thinking of it as that like kitten or puppy's life to adoptability age, shorter, longer foster durations, and how that kind of can open up the door for different ways to use fostering. And then last but not least, which maybe is a little applicable to the question about behavior fosters, is expanding our definition of what is a foster caregiver. Is a foster caregiver just somebody in their home or just a family? Or can we broaden that? Can we kind of broaden that scope? So what I have for a structure for the rest of my slides is kind of listed out in all these different categories. What are the things that people said? What are the ideas that people at other shelters gave as ways that they're using foster care in these general buckets? What are some ways that I saw it? And I'm going to delve a little bit into one example for each of those 4 categories. So definitely not meant to be exhaustive, but just to kind of delve into those buckets a little bit, and then I'll turn open the gates and let you guys discuss. So talking about targeting new populations, I think this is probably the one that is most straightforward to me. It's probably the one that when I was in practice that we thought of first when we thought about different uses of foster care. And as we saw with the show of hands, I mean, all of you guys are already using foster care for your neonates. Some programs, I know particularly some of like the ASPCA programs, and depending on the area that you're in and then your intake demands, bottle feeders might be something new in that population. And so something like adding bottle babies into your target population if that's not something you're doing already. Cats with ringworm is a particularly hot topic at the ASPCA right now, but I think there's a lot of programs, including from my own experience when I was at the Animal Rescue League of Boston, that used foster care to treat ringworm, especially if we don't have great isolation facilities in our brick and mortar facilities. But so that's a way, it's a disease that maybe, when I first started, 10, 15 years ago, we weren't necessarily treating, but now we can be creative and we can use foster care to treat that. Geriatric animals as kind of the face of what is a shelter animal changes, especially in certain parts of the country. But I think generally speaking, it's a pretty universal trend in this country that, a healthy geriatric animal is a pretty adoptable animal. And so how can we use foster care to support the health of those animals on the opposite end of the spectrum of also having a high disease risk, just like our neonates? Hospice candidates. We'll talk a little bit of that as well when we talk about foster duration. I think there's a quagmire that can be associated with talking about hospice fostering, but it was one thing that came up very commonly when I put out that kind of ask for opinions from the ASV was using foster care to manage animals that are hospice, which the definition of what is hospice is a whole nother possibly lecture in and of itself. But that is another target population that a lot of shelters are addressing with foster care. A lot of you guys are using foster for behavior. I agree. I think behavior foster comes with its challenges because that is asking a lot of our foster homes. But at the same time, what incredible benefits from foster care for our animals that might have, fear issues, high arousal issues in shelters, both cats and dogs. And then the last new target population, and again, we'll come back to this a little bit when we talk about foster duration or foster location, are highly adoptable animals. And using animals as sort of ambassadors out there, or giving animals a break from the shelter that are not necessarily animals that we would think of as needing foster care, but that basic tenet that any animal benefits from foster care and their side benefits to getting our animals that we want to showcase kind of out into the world. So one example that I wanted to delve into just briefly of targeting a new population, and this may or may not be new. A lot of you raised your hands with medical recovery, but feline URI is a topic that I could talk about all day long because I think it's such an interesting disease because it's such a preventable disease in our shelter cats. And I also think that foster care is a really, really lovely way to manage URI in shelter cats because, isolating them in a shelter has all the negative aspects of prolonging their length of stay and the stress of still being in the shelter. Whereas getting them out into foster care, we reduce that risk of contagion to other cats, but we also can reduce their stress and we can get them in a comfortable environment. It can allow them to recover more quickly with less need for medication. So I mentioned this as an example. I don't think that this is necessarily a super, super innovative thing to do. I'm guessing a lot of you probably out there are already doing this if you're doing medical recovery in foster care. But I think this is a really neat example of kind of a low-hanging fruit. Most of our foster caregivers that are able to take care of our kittens and our neonates probably feel relatively comfortable taking care of a cat with URI. It's not necessarily a huge ask. They're probably doing it already a lot in the kittens. And so it's a way that, to consider expanding a foster care program in a very doable way. That's just an example of one way that a new population of your shelter animals could be targeted. The next bucket was sort of expanding your services. And this could be taken in a lot of different ways. And there were a lot of different ways that the kind of respondents talked about doing this. Short-term sheltering is one thing that I asked about. We'll delve into that a little bit in the next slide. Disaster response. I think Dr. Broadus is in the audience somewhere. I think you might have responded that. But using foster care as a way to enable your shelter to be an active player in disaster response in a way that maybe you haven't been able to do before because of limited capacity. And so if you're using your foster care network, either to put, oftentimes I think to put your current shelter population in foster care so that you can open your doors for animals that are in need of temporary sheltering due to a disaster, that can be a pretty cool way to use foster. Extending your medical capabilities, this blurs with the target population bucket, but I think, of deciding that you're going to expand your services to, intaking diabetic cats and treating them, well, something like foster care is a way to do that. That cat in the picture is not diabetic. He is a cranky old cat who lives in my house with kidney disease and constipation and stuff, so he's just up there as a picture of an old cat, thankfully, not with diabetes. But so using foster care as a way to expand services like your medical services is one way to look at foster. Behavior rehab, being able to take on additional behavior work than maybe what you were doing previously because of using foster care. I think it comes with its challenges, and it's a major capacity thing to plan for, but certainly is one way a lot of us are being tasked with rehabilitating more and more complicated behavioral cases, and foster care can be a tool to enable us to do that. Delving in a little bit to the short-term sheltering as an example of expanding your services, because I think it's a very apt example for many shelters right now. I know when I left the Animal Rescue League of Boston, there was an active conversation about how to help partner with some human health services to expand the services and get even deeper into our community outreach program. And so they were talking specifically about partnering with an organization, a human organization that responded to domestic violence victims, and using the shelter as a way to short-term house those animals of those people. And I think foster care is a really lovely way to do that because clearly it's a nicer environment for those animals to be in. It doesn't overcrowd our brick and mortar shelters, although again, they're still in our system. We still have to plan for them. It comes with its challenges, and we'll kind of circle back to that in the end. And those that are doing it, I would love to hear how you structure your program, because I think it needs to come with a lot of planning and with a lot of sort of, really keeping an eye on the mission and on the plan and setting very, very clear parameters with both your foster caregiver and also with your client, whose animal it is that you are short-term sheltering. But I think it's the way a lot of us are going as organizations in terms of how we are expanding in our services. And so I think foster care is one way to make that happen, and one way that I think we're going to be increasingly kind of tasked with using to make that happen. Our next bucket was rethinking the foster duration, which I think can go on either side of the spectrum. Again, when I think foster care in a traditional way, what I think about is, like, I'm putting my underage, well, I practice in New England, so there weren't a lot of puppies, so my underage kitten in foster until they're of an adoptable age, or my cat that's recovering from orthopedic surgery for a month or two, or my cat that's recovering from URI for a couple weeks. So you're in that 1 to 2 month duration. You're in this sort of middle of the road duration. But let's think shorter or longer. And so a lot of shelters have some really cool programs where we're looking at sort of just a day. And so it kind of blurs the definition of what is a foster home versus just sort of an outing with a volunteer. But I think if we start to talk about that very short term, or maybe expanding that just slightly and talk about overnight stays, long weekend stays. It's the holidays, our shelter doors are closed. Let's do foster for this very brief period of time to give their animals a little bit of a respite from the shelter when we know they're not going to be able to be adopted anyway. On the flip side of that, there's some foster programs, some of which I think we've been doing for a long time. Foster to adopt is not a new concept. A lot of us have been doing that if we've got animals with medical conditions that preclude spay-neuter. But using foster to adopt, using basically our adopters as a foster home. I think from when I was in practice, and I know I have the luxury of treating heartworm disease in Massachusetts and not in Mississippi, but we saw heartworm disease on a relatively small number. But rather than try to use our existing foster network, especially because we're talking dogs, and I think it's a little bit more challenging to find fosters for dogs usually than for cats, trying to find a foster for the duration of that heartworm treatment can be challenging. But if we can use that adopter as a foster, even while we're providing the ongoing medical services, and yet that's going to be that lifelong permanent home for that animal, I think is a nice way to look at it. And then hospice fostering, again, we're talking the duration of that animal's life. Again, I don't want to, I think I have a bias that becomes very clear that I think hospice fostering can be wonderful, but also a big quagmire because it has to be very clearly defined of what you're talking about for hospice. But that said, I think it can be a lovely option for some animals that we just really want to have a win with and not necessarily just make a euthanasia decision for, because we think that they could have a nice quality of life for a period of time, but they don't really fit what we feel comfortable putting with an adopter. Delving into one a little bit, Dr. Stacy Cannon from Metro Animal Care and Control gave permission for me to talk specifically about her program. That's their kind of their little graphic that goes along with their Bow Wow Breakout program, which is what they called it, which I think is super cute. So here you've got a busy municipal shelter, but that has implemented this program where basically the dogs just get a little bit of a break. It's a partial day or full day outing, and I think a lot of shelters are doing this. I know the ARL was doing this before I left. It's a really great program, and it's mostly for dogs. Dogs tend to benefit most from that. I will say there was a volunteer at the ARL who, so I'm really into ferrets, so I'm not judging her for that, but she was really into ferrets, and she would bring the ferrets out in their little harnesses, and they would go out to a park, and so it doesn't have to just be for dogs. But certainly I think we're mostly talking dogs. But dogs, it's a great stress reliever for the pet. Obviously, they get a little bit of a break, particularly when we're talking about our active, energetic dogs that could certainly use a break from the shelter walls. It's a great stress reliever for the person. I definitely know, it's a slippery slope for staff members to do things, I think, on their off time. But I do certainly know some staff members who would come in on days off and just kind of go for a hike with the dog, particularly if they were sort of in between pets themselves. It also is a great advertisement for the shelter. Oftentimes I think a lot of shelters will have little vests that the dogs will wear or a bandana, something that makes them a walking advertisement. And I think this is where we can talk about our highly adoptable dogs as actually being a good foster candidates because, again, they're walking advertisements for us when they're nice and friendly and cute. And it just speaks well for us as an organization to have those animals out there advertising themselves. And it exposes those dogs to adopters, of course, too. Somebody could see them that might be interested in them, and so it has that potential win of getting them outside the doors, exposing themselves to people that might be interested in being their home. And then last but not least, in the buckets of creative fostering is expanding the foster caregiver definition. So our traditional foster home is just that, a home. We're thinking an individual, a couple, a family takes an animal into their home. And there's a lot of benefits that come from that. Some of the benefits of foster care, like observing the animal in a home environment, come best from the animal being in a home environment. So it's certainly not to say that that is not a wonderful system, but we can definitely think beyond that. I think of the non-traditional home fostering administrative offices as something probably a lot of us are doing. Certainly we were at the ARL, the ASPCA is kind of office fostering animals. Office fosters is a nicest cat was an office foster at the ASPCA. It's a nice option because it's easy to some extent. There's some issues, but it's easy because it's just still within your walls. I know in Massachusetts we have really strict rabies quarantine laws, and so this was a nice option for animals that needed to be quarantined for 4 months, which is the requirement in Massachusetts for a wound of unknown origin, but they can't leave your premises because of the rabies concern. And so if you have kind of people that are in offices that it's safe to do so because of their own vaccination status and their own kind of knowledge, office fostering is a great option for that. But it can also be used for some behavioral work, especially for cats, but for small dogs and some other animals it can be appropriate too. I've seen birds definitely get office fostered in shelters. But looking outside of our walls and outside of the home environment, there's some other cool options. I mean, there's a lot of shelters that have had prison programs. That's not a new thing, but certainly that's one example of fostering. Fostering that's outside of our walls and is outside of a home environment that has a lot of benefits, again, as long as there's structure to support it. Doggy daycares was one example that came up from the ASV group that I thought was actually a really lovely idea, and not sure that it would apply for the behavior rehabilitation, but I think in some scenarios it might, because you do have people that are hopefully, not always, but hopefully familiar with dog behavior that are involved in those programs. So for the right dog, that could be a really awesome option to have them fostered in a doggy daycare, and they're certainly getting a lot of exposure to the public. Hotels is the example, to dive into that. In Asheville, we have some programs in Asheville, North Carolina, and the last time I was there, the hotel in Asheville keeps dogs in the lobby as foster. So these 2 little dogs that time. And what a great opportunity, right? Because these are dogs that there's somebody there all the time, because there's somebody always staffing the lobby desk. There's somebody always there to help take care of them. They get huge exposure. I mean, this is Asheville, so Asheville is very Ashevillean, and so there's all sorts of dog community. So it particularly works in the right community. And a lot of people that are coming are not local, but there are enough people coming through, and there's word of mouth, and many of us are there to interact with people that are local, and so it certainly gets these dogs a lot of exposure in an environment that can be great for them. It's actually, I did a little bit of Googling before while I was making up this presentation, and it's quite actually widespread in some hotel chains that are doing it across the country. So just businesses in general. For the right business, for the right scenario, can actually be a really great thing to consider as a foster home as it works. Again, you're getting a lot of exposure for those animals. All right, last but not least, but let me just put another plug in for planning. So there's a lot of really cool things that people are doing that are really exciting in regards to foster care. But just remember that they all come with a lot of need for support. And so before you dive in, think strategically about what makes sense for you to do. Think about your mission as an organization. Does this thing really actually fit with what we do? I mean, it might be really cool, the people that are doing some of that community outreach work, but if that's not your mission, that's not what your organization has chosen to focus on, or that's what the organization down the road is doing, so that's best for them to keep doing what they're doing well and us to not focus on that. Maybe choose something else that's right for you. So think strategically about what you're doing, and some of that is forming partnerships. Especially if we're talking about stuff that has like short-term sheltering, partnering with human organizations so that you're not doing it alone. So think strategically about what's the best way to do it. Confirm your capacity. Capacity for care is a favorite topic of mine, so it certainly comes up in this context as well. Make sure before you dive in that you can support it, that you can do it well. There's going to be bumps along the way. There's going to be lessons learned. But try to make sure that it's something that is reasonable to expect from your organization, from yourselves, staff and volunteers. And set clear parameters. It's hard to say no, but if you've got those parameters set up from the beginning, that okay, we're gonna, and this happened at the ARL, we decided that we were gonna foster some diabetic cats. That was a new thing for us in the last couple of years when I was there. We decided we were gonna delve into treating diabetes, but we set the parameter that these were only gonna be cats that were good body condition, did not have any other concurrent disease. And we did one, and it was a success, and everybody was happy. And then, of course, a really friendly cat comes in, but he's skinny, and he's got other stuff going on. And it was hard to say no, so we put him out into foster care. And he ultimately had a positive outcome, but it was not a very smooth process. It wasn't I don't know that it was necessarily the right thing to do. I think we could have helped more by sticking to our parameters. And so if you set very clear expectations for your program from the start, it can help you to be successful and not get burnt out with it. And with that, I can be contacted at erin.doyle@aspca.org. And not that I have all the answers in this, because clearly a lot of you guys are doing a lot of neat programs, but I'm happy to also help facilitate connections. Great, well, thank you.